care versus disease care. And I tell you, we've just launched this new Mystique Lifestyle Patch, and I don't think any of us really realize just how phenomenal this product is, how much this product can benefit our overall health, as well as being a phenomenal tool to help us lose weight as well, which it is doing so fantastically out in the field. So, Dr. Rouse, I put together on PowerPoint a lot, kind of an outline of what you talked about on Saturday, and so I want to make sure you're on here with us and we can hear you.
Hey, Gloria, it's a good evening, and what a pleasure, and thank you for taking care of PowerPoint business.
You're welcome. Well, this was an interesting topic, and I think by the time people hear a little bit about what we heard Saturday, they're going to be impressed. So I'm going to go ahead and just turn this over to you.
Thank you very much. And on Saturday when we were talking to the audience, you always know that everybody has the same feel. Everybody's becoming very cognitively aware of the power in herbal nutrition. You know, natural alternative therapies, they work. They actually work. And it's a great option having to take a pill that likely will do more harm than good. And if you don't believe me, you can go to the library, check out a book called the PDR, the Physician's Desk Reference, and it's with every drug. It comes with its own onslaught of misery. And modern medicine has not done a very good job at teaching people how to be healthy. That dominant medical model that we're all very familiar with is really not a health care model at all. It's a disease care model, and it focuses on using nothing but drugs or surgery to promote health. So that type of medical thinking is rapidly being replaced by a more rational model of health promotion. And anytime we can start focusing on what can be done to promote health rather than treat disease, and I'm proud to be a part of the His Xperia family. It's proud every time we start a lecture we can actually say, we do not cure nor do we treat diseases. And we proudly say that because we would much rather be on the alternative side of medicine in promoting health. We promote health care, not disease care, not disease treatment. And the deal is that we have a God who in his creation is on our side. After all, the body is fearfully and wonderfully made by the Creator, and our body, the human body, is given considerable power to heal itself. And once we realize that the God who made those nutritionals made them for a purpose, good nutritionals facilitate and enhance the process that God wants us to have in our health care. So above all, we realize, too, that it's done with a do no harm. When we talk about stuff from the His Xperia family, believe me, I follow the principle of health care. Do no harm. Do no harm, meaning we don't want to cause any side effects, and nobody has ever died, nor do we ever expect anybody to ever die from a good herbal, all-powerful, natural, nutritional. And we certainly cannot say that about any pharmaceutical agent because they have their own plethora of be aware of these side effects. So tonight, what Gloria was telling us about was that when I started lecturing on the whiteboard, just drawing little symbols here and there, I tried to get the people in the audience to understand that health care is vastly different from disease care. And what we do is we look at life from a root cause analysis. It's so very important in promoting your better health because the body that was fearfully and wonderfully designed by God is also going to send you signals. You know, you can read your book like your body like a book. If the light on the dash of your car came on, you don't run over to the hardware store and say, quick, give me some black electrical tape and slather it on the dashboard to cover up the red light. You know that red light's telling you something needs to be checked, whether it's air in your tires or oil in your crank or water in your radiator. And it's the same way. Symptoms are merely your body attempting to heal your body. That's right. When you have a symptom, your body has automatically gone into the heal me mode, And no doubt the causes for the malady can spring from physical causes, mental causes, emotional causes, spiritual causes. But we're finding that when you do rest your body, hydrate your body, treat it right spiritually, emotionally, mentally, on the physical side, prevention is always the best cure. Prevention is always better. A milligram of prevention is hugely better than a kilogram of trying to cure something. And we do it with utilizing dietary supplements, lifestyle changes, and anytime we can support and prevent diseases, you have taken an excellent step in the right direction. So good health begins with you. And one thing that's always amusing to me is that I have friends in the medical profession. They say, "Well, Dr. Charlie, you're over there in quackery," and that's not so, because we stand on foundational, fundamental research stuff. Now, way back when, at the turn of many centuries ago, when they were trying to turn a block of lead into a block of gold, they needed a catalyst. And the actual chemists that were involved in trying to convert lead to gold, they said, "Quick, give me that quicksilver. Give me the quicksilver, the mercury quicksilver, and let's see if it will be the catalyst for turning lead into gold." And the name of quicksilver, mercury in German, the German word for mercury is quacksilver. And that's where that term came from. They started calling the actual chemist the quacks, and ever since then, that term's been around. But we're not talking about quackery tonight. Let's learn some neat tools that are at our disposal, and we're talking about the lifestyle patch. And because the integrity of the patch is so important, saffron is the world's most expensive spice on planet Earth. Saffron is it. But we get the oil of saffron, mix it in our blend, and we put it in our product specifically to enhance the body's "I feel good. I just feel like $1 million." And that is a $1 million herb in your patch that will give you better sleep, better sense of well-being, and it also controls that part of the brain structure that is going to be on the addictive side. In other words, this saffron gives people who want to quit tobacco, nicotine. It gives people who want to quit ravenous hunger, eating attacks. Saffron is in our patch to control the addiction side of life. And also the neat thing about saffron is that it's very anti-inflammatory, very mood exhilarating. And over here in my store, on my shelf, we sell saffron by the pill. And people buy it on a regular basis for inflammatory problems, or for addiction problems, or for appetite control, or just for a better sense of mood. And the people pay $65 a bottle for that one nutrition. The second thing on our patch on the list there is Force-Lee. Now, that's not just any Forskolin. Sabinza Corporation is the world researching center for Forskolin molecules. That little mint, M-I-N-T, the mint family in the Forskolin is designed and put into our patch because we know that the body is always utilizing energy. Energy is the key. And the functional molecule in the human body for energy is called adenosine triphosphate. That means it takes 3 of those phosphates. The adenosine molecule holds 3 phosphate molecules together. Kaboom, you got plenty of energy. Forskolin is an adenosine monophosphate. That's 1. And if you will cycle that, take an adenosine mono and cycle it around, that means 2 diphosphate. Cycle it a 3rd time, sort of like, isn't it better when you're is Xperia looking for your paycheck? It's always better to see the cycles turn around and the money just keep flowing. Well, the energy body is the same way. And our forskolin in our patch is designed to give you adenosine monophosphate that can convert very readily into pure stamina and vitality. And because of that, your body has more oxygen to use. And we in our store, we sell forskolin at $35 a bottle, but we primarily sell it to people who have bronchitis, asthma, sinusitis, people who have inflammation of the vocal cords. Those kind of inflammatory problems are solved with cyclic AMP enhancers. And that's exactly what forskolin is all about. It cycles the AMP into the ATP. And then when people have lots of ATP, it'll start going over there in the visceral fat, that's the belly fat, and it'll start reducing fat cells to energy. So forskolin, besides being something that helps you to breathe better and lets your nose open up and your ears not get clogged up and your vocal cords to be stronger, it'll definitely help you to burn fat. So saffron and forskolin, just alone in the patch by itself, is already over $100 of retail product, and you don't pay anywhere near that for 30-day supply of what we have in the patch. But that isn't all in the patch. After that, we started putting extra good stuff in there, and this is the most probable reason that our patch is different from anything on the world market. Gym, everybody can't go to the gym and work out. So we brought the gym to you. Gymnema is the herb of choice for helping the human body to regulate and improve the action of insulin. Gymnema improves insulin. By the way, Gymnema is a perfect substitute for chromium. A lot of people in medical research say, well, I'm not into chromium. No big deal. Gymnema is a perfect substitute for that because it improves the action of insulin, and Gymnema reduces fasting blood sugar levels. Perfect. And Gymnema improves the overall blood sugar control. Perfect for type 1 diabetics, perfect for type 2 diabetics, and perfect for all of us who don't want to become a diabetic. It improves the insulin, so it makes insulin do what insulin was supposed to do, burn the sugar, give me energy. Otherwise, if you have insulin in the blood and it doesn't burn into ATP energy, it will convert and store fat. You don't want to store fat. You want to burn energy, and there it is. So already we've got $125 worth of nutrition in our patch, and we're not even finished yet. On the next slide is 5-HTP. And if you want to know that your endorphins, the part of the brain that is just definitely going to be able to curtail the sugar side of life. I mean, you have a strong appetite resistance towards sugar. And because of that, 5-HTP is in the patch, knowing that most people have a sweet tooth. But we also know that most people that we meet are very burned out. Too much financial problems, too many marital problems, too many children problems, too many health problems, and stress takes a toll. Stress makes things happen. Blood pressure wants to rise. 5-HTP helps to keep the blood pressure normal. People can't sleep at night. 5-HTP helps you to get a good night's rest, a good REM sleep. And when that happens, you wake up fresher the next morning, so now you have an improved sense of well-being. 5-HTP, besides controlling the sweet tooth, will also help in the regulation of endorphins, the power of serotonin, and the neat thing about other hormones like adiponectin and leptin. And if you want to improve your wake-sleep cycle, if you've gotten bent out of shape because you didn't get a good night's rest somewhere, this will get you back into the fold. And 5-HTP at the Dr. Rouse's nutritional shop sells for $30 a bottle, and we sell a lot of just that one nutrition, and we put it in your patch, so you never have to buy a $30 bottle just for that. And then on the bottom of the screen there, diiodotyrosine. This is unique, and it's in the patch because everybody we meet, 90+% of the people we meet are extremely deficient in iodine. You do not get it in your food. You cannot shake it out of the salt shaker. Morton salt with iodine is not sufficient, and we need a molecule of iodine that is totally bioavailable, bioabsorbable, and utilized for the thyroid system. The thyroid hormone is regulated metabolically with the iodine that is in our patch. And people that have low iodine levels will find that this patch, this lifestyle patch, will become the most amazing miracle to them. People with low iodine have brittle fingernails, always breaking. They have cold hands and feet. They have cold intolerance. They are constipated more often than not. They have that mullygrubs and the moody blues throughout the day. They have difficulty swallowing. They have drier skin than normal. They have high elevated bad cholesterol. They have high blood pressure that's not controlled. They have eyelids that are swollen. They have fatigue that is beyond just tired. They have more hair loss in their comb and brush. They have a hoarseness about their voice. They have a concentration problem. They can't stay focused. Women who try to get pregnant, infertility is a common problem because of iodine insufficiency. Their mood is more irritable than it is sweet and docile. The young girls that go through menstrual cycles complain of all the PMS factors with the cramping. People with iodine sufficiency will complain of leg cramps at night when they're in the bed. People with iodine deficiency will feel weaker and muscle weakness. People with iodine deficiency are more prone to be nervous and jittery. They certainly have a poor memory. They have puffy eyes as well as eyelids that are swollen. They're much slower in their walk and much slower in their get up and go. Their heartbeat is even slower. And they'll complain more often of throat pain. And certainly everybody who's iodine deficient has a miserable time of losing weight. So I'm telling you what, the $25 worth of diiodotyrosine that's in your patch, that 30-day supply that comes with your patch, consider it a freebie. We throw it in there, but it stops all of those symptoms that I mentioned of the low iodine levels. So as you start looking at what's on that 2-inch by 3-inch square piece of real estate, what's on that rectangular piece of real estate? A pharmaceutical-grade polyfoam. We take the saffron, $65 worth. We take the forskolin, $35 worth. We take the gymnema, $25 worth. We take the 5-HTP, $30 worth. We take the diiodotyrosine, $25 worth. And we blend it into an organic glue, one that is so favorable. Even if you ate the glue, it would be beneficial to you. And this glue is then slathered in with all of our nutrition. We needed a glue that would not bind up our pharmaceutical nutrition. We needed a glue that when you stuck it onto the skin, that it would not cause hyposensitivity, allergy, sensitivity to the skin, but yet would stay stuck to the skin. That was a hard thing to do. We found the perfect glue that went with the perfect nutrition. So when you buy your patch, 30-day supply for $50, and you stick that patch on at the end of a month, remember, if you went to Dr. Charlie's store and bought those pills and had to swallow them 2 times a day now and can't even guarantee that the absorption would be anywhere near what we're giving you on a patch, you'd have to pay $180 just for the benefits. And you are in the Xperia family and can put it right there on the skin. And because we bypass the stomach and we bypass the first pass of the liver, this stuff goes directly into the system. You never have to worry about, do I take it before meals, during meals, or after meals? You put the patch on any time of the day, morning, noon, or night. It always works the same. Leave it on 24 hours straight, and it'll always take care of business. And the business is that we're raising your cyclic AMP levels to the perfect level. We're raising your iodine levels to a thyroid sufficient level. We're raising your brain chemistry, your serotonin, your dopamine, your epinephrine into a sensibility of I feel good, I'm not mad, I'm not sad. And when you put it all together, what you have is nutrition that can truly be called lifestyle. So don't just think of this little patch as a weight loss invigorator. Think of it as a lifestyle preventer of keeping your blood sugars from going erratic, your blood pressure from getting dysfunctional, your cholesterol from going out of whack. And that's the difference between health care and disease care. And you can mark it down. Dr. Charlie said it.